Are there any comorbid conditions, things that are associated with ADHD?
Yes, the mood disorders, depression, bipolar, anxiety, all of, the numbers vary up to 30 to 50% of comorbidity with the mood disorders. Also, there's personality disorders. About 20% of patients with ADHD may develop a personality disorder. I may have it already, in addition to ADHD.
Now, what do you mean by personality disorder?
There's different traits that we all have inside of us. When it becomes pathological, i.e. keeping us from functioning socially, occupationally, in our family, it becomes what we call a disorder. It's the way we view the world. Personality disorder patients sort of view the world through their own lens. For example, an antisocial personality disorder is really have a little regard for rules, for somebody else's property, somebody else's rights, and that may be associated with ADHD in some situations. Or a histrionic personality disorder. They just really worried about how they look. Just more above most people. They want to make sure their hair is perfect and everything has to be exactly right, and that's the focus of all their conversations.
Okay, now we were. What about like anxiety or alcohol? Is that are those?
Alcohol is very common with ADHD. Actually, it's the alcohol and marijuana is the most abused drugs that ADHD people have, and also the most abused drug that people without ADHD would abuse, alcohol and marijuana. So it's a constellation of comorbidity, depression, anxiety, personality disorders, antisocial behavior. It's not really the personality, just plain antisocial behavior. They might have a pattern of rest and breaking and entering, just real impulsive behavior that we think was started way back in childhood.
And then, obviously, learning disabilities might be something that they could have, I guess, but that they could be misdiagnosed as having when they really just couldn't pay attention.
Right. About 20% of patients with ADHD will have a learning disorder. These are, bona fide disorders that can be monitored. They may have problems with mathematical expressions or viewing three-dimensional figures and things like that they would need, say, in geometry. They just don't really get it. Not because they're mentally retarded, they're just sub-average in that category. And you can work with them and try to improve them up to a certain point, but we all have our fields that we like, we have fields that we can't ever do no matter what.
Now, what about some of the myths about ADHD? Let's take the medicine, for instance, in terms of it's like amphetamines, and whether it's addictive or something that they would abuse.
Right. I think that's why the ADHD in adults is misdiagnosed, because a lot of physicians say, well, say Ritalin, for example, is chemically similar to amphetamines or cocaine. So they figure if you abuse cocaine and amphetamine, hey, it's naturally you're going to abuse Ritalin. But Ritalin does not saturate the brain as quick as, say, cocaine, especially IV cocaine. So you don't get that rush that you would get with the cocaine, and hence you don't get that addiction. And there are going to be people that abuse Ritalin, they abuse any drug. You always take that chance, but it's not because of the properties of Ritalin per se compared to cocaine. But just because it's chemically similar doesn't mean it's going to lead to that abusive behavior.
So childhood ADHD and putting them on Ritalin, that doesn't predispose them to using cocaine or other substances of abuse when they get older.
Right. They most likely will abuse marijuana or alcohol, which aren't stimulants. So you would think if they're going to be on a stimulant, they would more likely use, say, cocaine or something like that. But they abuse alcohol and marijuana. Actually, treating somebody with ADHD, actually, I feel, decreased their risk for abusing drugs.
Yeah, I can see that it would, just like what we were talking about, the tragedy of missing the diagnosis and not getting them education. A
lot of patients, they're going to sort of self-medicate anyway, so they're going I don't want to overlook the excessive use of caffeine or the excessive use of nicotine.
The adults with ADHD are unrecognized, I think, like a lot of psychological and psychiatric problems. As a society, how do we get around that? I think there's still people think you go to a psychiatrist, that means you're crazy. Obviously.
Right. I think we're getting smarter now. I mean, the media, television, print media, everything is helping people come through my doors, and any psychiatrist's door or a psychologist, but just getting information out in schools. Teachers talk about it. Teachers could really make a big difference in who gets treatment or not, because most teachers actually invite the parents in sometimes of the students that may have certain problems, and the teachers see that even the parents are acting, some of them acting sort of hyper, and they can say, well, I see a trend here sometime, but it has to be done in a loving, caring way, though. You don't want to point blame at a child's ADHD.
I meant to ask this earlier, but you said the teacher might notice the parent. What about the families? Is that something that's in families?
We tend to think it runs in the families, but we really don't know to say what chromosome is on, anything about the genetics right now. We just be taking a guess, but we do see it sometime in the families. I do see, a father and a son with ADHD. I do see that, but I don't know if it's correlated or causated.
We've been talking with Dr. Clemmy Palmer about ADHD. Clemmy, thank you very much.
Thank you.